In your Health Watch this morning, melasma is pigmentation. It causes dark spots, mainly here on your face, like your cheeks area, caused by hormonal imbalances, and it can be difficult to treat.
But one Valley aesthetic nurse to treat it and hopefully keep it away. Fox 10's Danielle Miller has the story.
All right. So we're going to add.
Jordan Smith is on her 7th month of an 8-month program of what's called the Skin Brightening Boot Camp. It's a 32-week program designed by registered nurse and owner of the Aesthetic IQ clinic, Marissa Abdo. Jordan's melasma started to come out a few years ago.
My forehead spots never really bothered me until I started getting them, noticing it more on my cheeks, and that's when I started kind of being like, maybe I should do something about it.
And that's exactly what she did. With the help of Abdo, her skin has gone from this to this. Abdo says many women and even men suffer from melasma.
Melasma can happen with hormonal changes, so like a lot with pregnancy. That one's going to be a little bit more stubborn than just your regular pigmentation. And when we're talking about pigmentation, it's kind of a two-pronged battle where those face cells, they're going to come to the surface, which takes weeks. So we really need to suppress that pigmentation production from the bottom layer of the skin and also work to get rid of that pigment on the top layer.
Pigmentation from melasma typically comes out on your forehead, cheeks, upper lip, and jawline.
We have our cells at that basal layer, that melanin, which is going to be the pigment, that's going to start down below at that basal layer of the cells. And then it's going to take about 6 weeks for that cell cycle to get to the top, where we're actually going to see that pigmentation. So even if you're not seeing pigmentation right now, it doesn't mean that, if you had a sunburn, you were out in the sun a couple weeks ago, that's all resonating down here. That's going to come to the surface.
Marissa says the 32-week boot camp may seem long and intimidating, but she's seen the results in her patients. The first few weeks, she preps your skin.
What we're going to do is spend about 6 to 12 weeks just getting your skin prepped. And what that means is that we're going to get that skin barrier healthy. So then your skin is going to be able to handle a little bit more aggressive products.
Those products are ones that target the right skin cells. Marissa says these take care of the pigmentation from the top layer and maintains it from the cellular level.
It's products like retinol, retin-A, tretinoin, hydroquinone. These are going to really suppress and stop that pigmentation, that melanin production at that basal layer, so then it's not getting to the surface.
After the skin is prepped, Marissa bumps up the product strength each month before eventually tapering down the strength.
Then we're going to be in our active phase of actually using products that are going to be prescription strength, like hydroquinone, tretinoin. That's going to be a little bit more aggressive on the skin, which your skin should be able to handle by that time because we've prepped it appropriately. And then with these products, the other important thing is that we need to titrate you down and taper you off these products.
Once patients complete the 32 weeks, they're then put on a maintenance schedule.
If we at any point start to get a little more pigment back, then we can start to bump up our treatments again if the maintenance isn't quite doing the trick. But for a lot of people, once we do that initial kind of big cycle for the boot camp, we can just get you on a maintenance program.
Jordan is nearing her maintenance-only schedule. She says the first phase of the program wasn't always easy, but things quickly got better, and the results for her are priceless.
My forehead, all in here, was very, very dark. I have 2 spots on my cheek here, very, very dark. And 6 months ago, it's a complete change. Hardly see it now, especially when I don't have makeup on. It's really, really nice. And the pictures are encouraging. Every time I come and see Marissa every month, we take pictures, and month to month it's changing. I'm having people notice, just at work or whatever, and they're coming in there, your skin looks so great, it looks so nice, it looks so smooth. So it's been a huge difference.
Marissa gives patients a dated step-by-step process to make the boot camp seamless. The cost for the program is about $400 a month. Danielle Miller, Fox 10 News.
What a great story. Yeah, some women need that, little help. And we all need some help. We all need help.